We're gonna start out pretty hot, controversial. There's a lot of topic around it. What are your thoughts around Ozempic? All right, welcome everybody to You're the Cure, back by popular demand.
Yeah.
You or me?
No, I requested back to come back.
It's another takeover. This one is taken over by you guys. So a bunch of you sent in some questions, things that you would like Dr. Ben to answer. So we're gonna start rattling them off. Hopefully you get your questions answered, but there is a lot of good ones. So make sure you stick to the end and we're gonna jump right into it. Are you good?
You saving the best for the last?
I think so.
Okay.
It's a good one on the last one. So hopefully you've done your homework.
Hey, I'm ready. Let's go. If I don't know, I'll just say.
We're gonna start out pretty hot, controversial. There's a lot of topic around it. What are your thoughts around Ozempic?
I need my wife here. She has this bishop guy that she plays. Whenever she tells me no, she just hits play on this guy. It's a song. I kind of got to hear it. I better not. Okay. I'm not a good singer.
Okay.
I had to take. This is a little. I'll get to the answer.
We have time.
Way back in the day, church choir Wednesday night, the choir teacher calls me out of the whole group and says, "You can't carry a tune at all. You need to stay late and practice. Do extra." Really embarrassed me. My brothers and sister just, stood outside the door and laughed at me. The choir teacher said, "Now make the siren sound." And I just said, "Woo, woo, woo." I mean, I didn't know.
Nailed it.
She's like, "No, not like that. Like this." Which I didn't know that. Anyways, Ozempic.
Yeah.
One
you're
word
okay
answer.
From that? You healed from that?
No, there's damaged me. Negatory, no, don't like it. And that's just not being negative. Here's a problem. I mean, there's multiple problems with Ozempic. Obviously, obesity, that's a symptom, and you're going to micromanage and manipulate some physiology to force that symptom to go away. And as soon as you remove that Ozempic, the symptom's right back. So number one, it's not fixing anything. Number two, if you're going to just treat a symptom and kind of cover up that thing, even though you do lose weight, but half of that's muscle, and we'll talk about that in a minute, you're not dealing with the underlying thing, so you're still at risk for horrible outcomes long term. Decreased lifespan, decreased quality of life, cancer, heart disease, stroke, all the standard American things, because that's a symptom of the carburetor not being tuned up. I mean, it's that simple. Now, side effect wise, when I get 3 calls in 1 week from the general public asking if we treat Ozempic side effects, and they were all the same 3: gastroparesis, paralysis of the gut. 2 of these people were hospitalized for it. And that's 3 in 1 week just at our little clinics. So if I'm getting that many phone calls, I can imagine the frequency of that problem. But the biggest red flag is 50% of that weight loss is muscle mass. You lose muscle. That's called sarcopenia. I think I've seen online Ozempic face. It's just this depleted, anorexic looking face. It's because you're losing not only sub-Q fat, but muscle. And a lot of doctors, including Gabrielle Lyon, who has a clinic in California, she wrote a book called Forever Strong, and she talks about how we don't really have a fat issue, we have a loss of muscle issue. When we lose muscle, our mitochondrial dysfunction just gets even worse, and we naturally lose muscle with age. 80% of those carburetors that aren't tuned up are in the muscle. So we've got to get the muscle back. We've got to do resistance training. So Ozempic just obliterates your muscle. So between gastroparesis, sarcopenia, and the fact as soon as you stop it, the weight comes right back, it's a negative.
So for people that don't know, Ozempic it's a weight loss drug. Is it an injection?
Well, it was originally developed and marketed as diabetes drug. Now everybody's using it for weight loss. It is an injection, and it mimics a natural protein in the body. This particular protein in the body has a very short half-life, lasts about a minute or 2. But they've altered it synthetically to make it last about a week, and it really just slows down your GI tract. And it's not dealing with the root cause. And they're so aggressively marketing this all the way down to 6-year-olds. Even the American Academy of Pediatrics is doing that. And then the cost is like $1,000 a month. They're trying to push it through and get Medicaid, Medicare to cover it. And I mean, it's just, it seems obvious to me this is a major pharmaceutical push for money.
What would you say would be just a natural thing that people are seeking Ozempic for? What would be just the right way to do it?
Well, people want the quick fix, and I get that. You're overweight, you want to see results fast. Well, that's what the intermittent fasting keto thing was all about. Like we talked about before, that's okay for the short term, especially if you've abused synthetic or highly processed carbs like a standard American does, unknowingly. But highly processed carb abuse for decades. Fasting, intermittent fasting, low carb keto, short term you can get some of that rapid weight loss, but even then long term we've talked about we don't like that because you're losing some muscle, you're losing a lot of water weight. But long term your body actually shuts your mitochondria down because you need carbs. So the real answer is mitochondrial tune-up, and we do that with nutrient-dense foods. I call them the 5 superfood groups, so fermented food, homemade bone broth, organ meats, fresh milled grain, and raw dairy. The amount of nutrients, we want nutrient-dense, so just think of flooding your body with as much nutrient-dense real food, the way God intended it. So nutrient-dense food, resistance training to get your muscle mass up, because remember, the focus is mitochondrial tune-up, and 80% of these mitochondria are in the muscle. So you got to do resistance training to do that. We need circadian rhythm management. That means get sunshine. First morning sunlight, that's Jack Cruz, Carrie B. I interviewed her in a previous podcast, but the sun's super important, 30-30-30 rule. Within 30 minutes of sunrise, within 30 minutes of sunset, your eyeballs need that light. And then 30 minutes of intense midday sun. So, and good sleep. And no sleep apnea, no snoring, no mouth breathing. We got to have good oxygenation at night. So we just got to run the checklist for mitochondrial tune-up. Now this takes time. It can take 1, 2, 3 years. You spent 30, 40, 50 years abusing highly processed American carbs. It's going to take a little time, but that's the right way to do it.
So really what you're saying is if we do healthy habits, a side effect or a fruit of that is just going to be weight loss.
Yeah. When you tune up that mitochondria, everything starts to get in order. That's why we have people come back and say, my arthritis is better, my high blood pressure is better, my sugar is better, my sleep is better, my mood is better. All of this is related to mitochondria. So when you get the mitochondria tuned up, you have across-the-board benefit, including weight loss. But I know that takes time. People want the quick fix. I get that. We're too busy. It's too hard. We got to change our habits. And I mean,
what's interesting is I've even heard stories through our corporate wellness program where people have just immediately cut out seed oils. They were diabetic, cut out seed oils, and within 3 to 6 months weren't diabetic anymore. Now, maybe they didn't lose 50 to 100 pounds in that 6 months, but they're healthier. And I mean, that's a pretty quick fix when you just get rid of that junk, which is pretty amazing.
Yeah, and that's one of the reasons we like to do that blood panel in our wellness program, because when you see that inflammatory marker come down, and the fasting insulin come down, fasting sugar come down, you can make some major changes in the blood work pretty quick by just doing simple things like get the seed oils out. Now those, the weight loss in particular may be a lagging indicator, but you see that initial change in inflammatory markers, you're on the right path. It's just stick with it. I mean, and part of it's tough because it's just too simple. We're saying just get back to how your ancestors did. There was no obesity. Zero obesity. I mean, it was like so rare. They put people in the circus, it was such an oddity. And definitely in kids, none. No diabetes in kids 50 years ago. Pediatricians never saw that. And now it's rampant. So we just got to get back to the way we used to do things, eat real food, move around, get good sleep, turn off all the blue light, constant blue light. We get outside and get some sunshine. I mean, it's these basic things.
So we probably won't have Ozempic sponsoring this podcast.
Yeah, I haven't had any Ozempic reps come in the door here.
So next question, speaking of injections or shots, a common question is the flu shot, because we're kind of getting into that season. Is the flu shot the best way to avoid the flu?
Well, I'm glad you asked. I was just pulling a study from 2018. I mean, this is one of the most aggravating things is the marketing of it. I mean, walking into a grocery store and on the overhead intercom speakers, you just hear, come get your flu shot. It's free, covered by most insurance. It's the best way to prevent the flu. I mean, I have colleagues who promote certain natural things as good, or if you accidentally say the word cure or treat something, they get a letter from the Federal Trade Commission. False advertising. Take that off your website. You know, you can't claim vitamin C treats or cures anything, because that's, until the FDA says that treats something, you're not allowed to use that terminology. So, I mean, colleagues have got a letter from the Federal Trade Commission, false advertising. So when I hear that, or when I call into calling a prescription in for a patient and I hear the recording at Walgreens, come get your flu shot, best way to prevent the flu. The best way, here's what the best is. This is February 1st, 2018 Cochrane review. The Cochrane is this group of independent doctors from around the world. I think it's like 100 plus countries. These researchers and doctors that are independent, don't take money from industry. They get together and they look at all the data. So this particular study on the influenza shot vaccine. So they looked at randomized controlled trials comparing the flu vaccine with placebo. This included 52 clinical trials, over 80,000 people, looking for the safety and effectiveness of flu vaccine in healthy adults. These studies were from 1969 to 2009. So a long time, a lot of people. Here's the overall, when they averaged all the data. The authors found the flu vaccine probably reduced influenza in healthy adults from 2.3% of people who were not vaccinated got the flu to 0.9% who were vaccinated got the flu. So that's 1.4% difference. That's the best we've got, is a 1.4% difference. So translation on that, 71 people would need to be treated with the flu vaccine in order to prevent one case. And now what they don't say here, but other studies do, is to prevent that one case, you actually increased your risk of other flu-like viruses. Because influenza is just one, or I mean, there's different strains, but there's rhinovirus, there's coronaviruses, there's 10,000 different viruses that'll give you fever, snotty nose, cough, body aches, flu-like symptoms. Well, you actually increase your risk of these other ones, like coronavirus. There's a study from the Department of Defense that showed this in soldiers. You get a flu shot every year, you increase your risk of other viruses. So basically it's a wash, or even maybe a negative. But just for flu, it's a 1.4%. They went on further to look at risk of hospitalization. What did the flu shot do for that? 14.7 versus 14.1, so a 0.6% decline in hospitalization rate for influenza. So when you hear that on the loudspeaker at the supermarket, at the pharmacy, this is your best way. I mean, if that's the best we got, 0.6%, no wonder we're so sick.
Jeez.
So obviously it's not the best way. The best way is to steward the most amazing flu detection system and killing system known to man, and not only flu, because that shot's usually it's 3 different strains of influenza they've targeted. What about all the other strains of influenza? What about all the other viruses? So the best way for obviously to prevent all that is steward your own immune system. And I do want to say, having a fever and being a little sick, it's not the worst thing in the world. There's actually some benefit, especially in kids. Very beneficial. There's lots of data that if you get chickenpox naturally, measles naturally, these childhood illnesses naturally, it incurs long-term benefit across the board on your immune system, including less cancers and less heart disease. A tuned-up immune system is so important for lots of different things. So these kiddos in particular that have a little fever and a little cold, little flu, that's fine. They'll get through it, steward their immune system, nurture them through that, and they'll be stronger for it. We don't need to fear these bugs, and we definitely don't need to rely on man-made synthetic aluminum, mercury filled injections.
So even almost the best defense for flu would be the same thing that you said about Ozempic. Is just, again, back to stewarding, sunlight, nutrition, all those things that we teach here.
I can almost guarantee you all the questions you're going to ask me.
Should we just end the show?
Broken record, I mean, but it is. Our ancestors did not have this trouble.
Yeah, it's amazing.
Tuberculosis is way more infectious and contagious and dangerous and deadly and all that, tuberculosis, than influenza, COVID, any of that. And Weston Price documented this. It was so stark. He would see this in these villages that had access to processed white flour and sugar. Not only would they have hypertension, malignancies, heart disease, rotten teeth, they would succumb to tuberculosis. And just down the road 10 miles, a village that was eating ancestral and were healthy, and he would describe these people just physically, just their physique even. One village, I think this was in the Swiss Alps, he said it could hold 100 pounds in their left hand, 100 pounds in their right hand, 100 pounds in their teeth. But he said this village is tuberculosis resistant. Tuberculosis can't penetrate this village for some reason. They don't get it. Obviously, the bug was around. A few miles away from the village that was being ravaged. Their immune system was strong. So it is a broken record. It is the same old thing. We want a quick fix. We want these, take a shot to avoid whatever and take a pill to get a result. And that's why we're in the mess we're in. That's why we're the sickest country in the world. This deception that we can do a quick fix and just eat garbage and sit all day under artificial lights.
Well, that kind of brings me to this next question, which I think a lot of it is mindset or fear or things we've been taught we don't know. You talk about just knowledge. Somebody that sent in this question that I'm sure a lot of people believe this thing, but I just want you to speak to. The question was, what is the best thing for genetically high blood pressure? So how do you deal with that? But I think you can speak to that major thing in that question of maybe just this myth that we believe that, well, my parents had this, so now I have this, and how do you deal with it?
Yep. So my opinion is there's no such thing as genetically high blood pressure. Now understand whoever sent that question, it's probably what their doctor said, or they may have even come up with it on their own because their dad has it, and their granddad has it, and their great-granddad. So I understand where he's coming from, but I'm telling you my opinion, and I'll tell you why I have that opinion, is there's no such thing. And I would encourage that person to go on our website and find the 4-pillar videos. And there's a video on each of the 4 pillars, but the introduction video to those 4-pillar videos talks about epigenetics. And just real quick, epi means above the genes. So even if there was a gene that predisposes you to hypertension, you can keep the gene turned off. And that's what that video goes in depth about. But one study in particular, the agouti mice, these mice are bred with a gene, they purposely mutated this gene that makes these mice obese so they can study obesity and diabetes. So this is just a genetic line of mice that they're obese. Well, somebody had the idea, I'm going to feed this mama mouse, obese agouti gene mouse, I'm going to feed it a bunch of B vitamins prior to conception. So they did that, and then the mama rat got pregnant, had the babies, and the babies came out normal, not obese, and normal fur, brown fur, because the gene defect also affected the fur, made it yellow fur in these obese mouse. The point is, the agouti gene's still in that baby mouse, but it wasn't turned on and expressed. It wasn't read. And that's what we see clearly, the research shows in humans, it happens. So Dr. Day, I've interviewed him on the show. Y'all can go back on the website, look at the archive page, and look up Longevity Plan, Dr. Day, or read his book, Longevity Plan. He goes to China, to the longevity village. These people live to be 100, 110, 115, healthy, no Alzheimer's. They're active. They're out working in the rice fields at 112. This guy said he's in his prime. Wow. Well, Dr. Day saw they didn't have any disease, but then he checked all their genetics. He pulled their blood, looked for the gene that predisposes to Alzheimer's and heart attacks and strokes and cancers like the BRCA gene and breast cancer, and they had all the same genes that we do. They just didn't have the diseases because those genes were turned off. So for this person's question, I would say really what's I would do to treat that is get the truth, gain knowledge, understand the power of your thinking, number one, but your diet and lifestyle. 'Cause also a lot of what we inherit, so to speak, from our mom and dad is how they live. Did they make sunshine and exercise a priority?
Right.
Did they stay up super late and not get good sleep? Did they eat processed food? How did they handle their anger or conflict? I mean, just it's the nature nurture thing. We inherit all the ways to live and think. A lot of it's from our parents.
Wow.
So don't worry, just do the basics, tune up the mitochondria, and that quote unquote genetic hypertension will go away.
It's really good. Okay, on to the next question. What would be a good alternative to antibiotics? So if we get something, we're suffering from something.
Alternative to antibiotics. So number one, you need to be clear that it's a bacterial infection that needs antibiotics, and sometimes that's hard to know, or your doctor could help you figure that out. A kind of general rule of thumb, bacteria like to find one particular spot in the body and just camp out right there and grow and make babies and make grandbabies and just, so think of an eardrum, a tonsil, one lobe of the liver, the bladder. As opposed to viral, you're going to be more kind of full body, multiple areas, like I got a runny nose, I got a cough, I got body aches, I got a fever, more generalized, that's viral. And you can't have sore throat that's viral, but you'll tend to have kind of a full head and more full body. So it's good to try to figure out viral versus bacterial if it's truly bacterial. And number one, I want to definitely say, when you tune up that mitochondria, your body's got the most amazing pharmacy built in. You make natural antibiotics in your liver. And your liver will increase production of that when it needs to. It's incredible. And even your gut flora will increase production of certain things that kind of work as natural antibiotics. So trust this system for sure, steward it, trust it, give yourself a little grace if you run a little fever. So we don't always need to run to antibiotics, is my main point.
Yeah.
Trust your immune system. It's probably usually viral anyways. But if I am battling I feel like a bacterial thing, silver, a lot of people have heard of colloidal silver. Which is fine. I really like silver hydrosol. It's silver formulated a different way in a particular brand or company called Argentin 23. You can get on their website and look around, read and research, but silver's awesome for killing bugs. Another kind of personal favorite of mine, it's a product that actually we carry, but it's a combination of oregano oil, thyme oil, and clove oil in a capsule. Those are very, very antimicrobial. And I've used that before in folks with pneumonia, with cellulitis, with sinusitis. So I really like that. And it's called Microbalance. It used to be called Intestinal. I forgot the name of it, but Microbalance on our website. You can purchase that. So if I'm going like overseas, especially going to be out of town on a big trip, long trip, I'm going to take Viracid and I'm going to take Microbalance. Microbalance is for bacteria. It's the oregano oil, thyme, and clove oil. Viracid has got all the antivirals, echinacea, elderberry, L-lysine, vitamin C, A, D, and E. Just a combination of things that are antiviral. And I'll take that every hour if I feel a viral thing coming on. If it's bacterial, if I feel like a little pneumonia developing, then I'll hit the Microbalance. Another good idea is keep a nebulizer at home. That's really good for lung infections. Nebulized silver, nebulized diluted hydrogen peroxide. So those are some of my favorite ones. And there's a bunch out there. There's homeopathic remedies, there's essential oils, there's a bunch, but those are probably my favorite.
Okay.
And I also want to say there's a time and place for antibiotics. I mean, I'm not just totally anti-pharmaceutical antibiotics. There are some that I tend to not like ciprofloxacin. That group of medicines can have some bad side effects. But when you need it, you need it. That's fine. But in a pinch, or if there's a supply shortage, or you just can't get to it, it's good to keep these in the medicine cabinet, silver and Microbalance.
Great, and we'll link some of those that we offer in the show notes, so you can click that if you want to purchase those. So on this kind of natural remedies thing, we got a lot of questions on arthritis. One of the things was, does carnivore diet help arthritis, heal arthritis? Another one was, is it possible to recover from autoimmune arthritis joint damage? So just arthritis in general, maybe if you want to take some time and just speak to that. I think a lot of people had questions about it.
Yep. So can carnivore be good for arthritis? Yes, it can. Again, that's using diet as medicine, food as medicine. So we can use carnivore, keto, even juice fasting, plant-based stuff in a short window, short, narrow time to attack inflammation really is what you're doing. When you do a restrictive diet, you're removing pro-inflammatory foods and you're just sticking with anti-inflammatory basically. So those can be very beneficial because they rapidly drop inflammation, and inflammation is going to damage the tiny little blood vessels, the capillaries that feed the cartilage in the knee. When you have inflammation, that automatically means decreased perfusion of your joints. You're not getting oxygen and nutrients, nor are you removing the toxicity. The byproducts of just normal cellular function need to be flushed out. And so things are just kind of stagnant in there, and low oxygen level, low nutrient level, inflammation in general. So carnivore, keto, low carb, even plant-based for a minute, yeah, it can be, but not long-term. Long-term, nutrient-dense food. Now we need to distinguish between autoimmune arthritis, that'd be like rheumatoid arthritis, and then just what people call wear and tear. Now the whole wear and tear thing, I mean, that's kind of like the genetic stuff. Our ancestors didn't have wear and tear, and they're way more active than we are. How are we having so much wear and tear arthritis, all this knee and hip replacement, when we're the most sedentary that we've ever been? I mean, you go to ancestral tribes and you have, 100-year-old ladies walking down a mountainside with a basket of blueberries on their head and carrying 5-gallon buckets of water on their head in Africa. I've seen this. They don't have wear and tear, and they're way more active than we are. So it's not wear and tear. The cartilage in our knees and in our hips and in our joints, like everything else in the body, it's designed to function and work and repair itself, regenerate itself for your whole life. The problem is this whole part of our system, I call it the auto-cleaning part of our system. The self-cleaning, self-repair, self-regenerating, that just autopilot cleaning system shuts down way, way, way down when you're in chronic fight or flight. Sympathetic dominant, fight or flight, stress, 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 cortisol, cortisol, cortisol. You're there too much, too often, too long. You shut down your self-cleaning, self-healing, self-repair. Stem cells, we have stem cells in the body. They're supposed to go in there and repair and keep that knee healthy and youthful. And that's what it did in our ancestors. But we've shut that thing down. We haven't nourished it, so it's already handicapped. And then we're in chronic stress mode, so it automatically shuts down. So I've seen people who are ready for a knee replacement. Even on x-ray, it looks like bone on bone. But just changing the diet and moving around a little more, they oxygenate that knee, they get nutrition to the knee, they get the inflammation out of the body, and their pain goes away. Their x-ray still looks the same. I'm talking 30, 60, 90 days.
Wow.
And their pain is gone. So it's amazing. Now there are some cool regenerative kind of techniques that some alternative clinics do, like ours, on the medical side, ozone, PRP, stem cells, different things. And those are fine. But I tell my patients, let's not talk about that first. Let's first get your self-healing mechanisms a chance.
Yeah.
Get the inflammation down, and then let's see what happens. If we need to come in later and do some of that extra stuff, that's fine. And I'm not opposed. We did a podcast on true dose PRP with a particular machine we have here for platelet-rich plasma, and that's where you pull someone's blood in a vial, you spin it, the red blood cells fall to the bottom, the serum rises to the top, you pull that plasma off, it's full of platelets, and you inject that into the joint or back in systemically in the IV. And those platelets activate your stem cells to come and repair. And so that was Tapley Holland. You can go back on the podcast and find his show. We interviewed him twice, I think, and actually had a patient on there give his testimony. And he was rheumatoid arthritis, but his pain went from 8 to a 2 on a 1 to 10 scale, and then it went to 0 after a couple PRPs. So that can be super beneficial. But that guy also had laid the foundation of good diet, exercise, and all that. So that leads us to autoimmune arthritis real quick. That's kind of a long topic, long story. I would recommend join the wellness program so you can get on our education courses and watch the autoimmune lecture and learn the root cause of autoimmune disease. Because in medical school, all the doctors got taught, including me, that autoimmune is, we don't know where it comes from. One day you just wake up after 50 years of your immune system recognizing your cartilage and your joints as you, just one day decides, oh, that's foreign, that's not me anymore, I got to go attack that cartilage. So that's rheumatoid arthritis, and it starts attacking these joints. Well, that's a theory. It's the only one taught in school. The theory, the just go berserk for no reason theory. Well, there's other theories, molecular mimicry theory, leaky gut theory, germ theory, that there's actual tiny microbes in here the immune system's going after, trying to clear out. So there's other theories, and I go through those in that class. But autoimmune arthritis is totally different. That's an immune system problem. We got to get your immune system balanced back out because it's out of balance. Part of it's overactive, part of it's underactive. We got to bring balance and order back to the immune system. Automatically, that means the gut, because 80% of the immune system's in the gut, and automatically it means you're thinking, because fight or flight disrupts your immune system too. So it's right back to the foundational things with autoimmune arthritis. It is reversible. You can put it into remission. You can become symptom-free from that. Psoriatic arthritis, rheumatoid arthritis, polymyalgia rheumatica, that's more in the muscles. But we've seen all these diseases go into remission. So there's hope. A standard American doctor's not trained in that, so obviously his advice is going to be, no, you can't reverse it. But our testimony that we've seen in many, many, many patients, and not just here, but other holistic doctors will tell you, oh yeah, we see patients reduce those symptoms and get off meds. When they don't need them anymore, you get off. And even reduce the symptoms all the way to 0. Now, a conventional doctor is going to say, no, that's anecdotal.
Right.
We don't listen to anecdotal. Medical school teaches doctors only listen to randomized controlled trials. And on the evidence-based pyramid, that's the highest level of evidence, randomized controlled trials. And way down at the bottom of the pyramid, which barely you're even supposed to pay any attention to because it's just not good evidence, is anecdotal, which that means someone's testimony. I went on carnivore for 30 days and my arthritic symptoms went totally away. If a patient tells a doctor that, the doctor's supposed to basically almost ignore that.
Wow.
We're trained to ignore that. We're trained that that's just an anecdotal story. That's not reliable. Which I think now people are waking up to, how that pyramid, just like the food pyramid, needs to be flipped. These anecdotal reports, we need to hone in on those. As doctors, we need to listen to those patients. And then we need to investigate that as best we can and maybe try it, especially when it's natural, it's a diet change. Come on, no side effects from that.
Sure.
Except your headaches can go away, you can sleep better, your anxiety might disappear, your heartburn's going to go away, and your blood pressure is going to get better.
It's too risky.
Your obesity is going to go away, and your blood sugar is going to come down. All these good side effects could come, and the arthritis can improve. Doctors aren't taught that. So we throw a pill at it, and we deal with the side effects, and we spend all the money, and we die younger.
Well, I'm glad you did your homework. I thought I was going to have to cover you on a bunch of these questions. So I'm glad you came.
You chime in anytime, Blake. I mean, I'm just one man with an opinion. So
here's a practical question. When do you have time to read and learn and do all these things? Because you have a wife. You have not 1, but 2, but 3. You have 6 kids.
Yeah.
So when do you have time to research this stuff, read this stuff? Do you sleep? Are you a vampire?
I do.
That was anonymous. It came from an anonymous person.
Well, in the beginning, when I was just waking up and being shown, and when I started really seeking and finding this truth, it was staying up late initially. I mean, because I felt, number one, I was so excited that there's all this whole world over here I didn't know about. And number two, I was seeing patients get better when I never seen that in 10 years of conventional medicine.
Wow.
I saw temporary symptom relief, but then no one got all the way well and got off meds. So I was super excited, super motivated, super curious, super interested. So I was like going back to school all over again. I felt like this is medical school all over again. And I would stay up late. I mean, real late.
Yeah.
And it was tough for sure. I mean, we had little, Jamie was amazing and has always been, but I mean, I tried to be a daddy and a husband at the same time, so I would just stay up late, and the Lord sustained me through that.
Yeah.
But now, where I've landed is like, I mean, it's still cool to read and kind of stay up to date on some cool stuff, but honestly, it's clear. It all is pointing back to the same thing. And that's what I remind my patients. You know, we can try to prove all this and mitochondria this and mitochondria that and seed oils do this and oxidative stress and inflammation and all the science. But I tell them, your great-great-grandparents didn't know what a mitochondria was.
Right.
They didn't know all this stuff we're talking about. They didn't know about it. So you don't have to know all that either. It's really a matter of trusting. We're designed, not evolved. The design's awesome, and if it's stewarded, it will function. So it's these real basic things. So these days, you know, I'll still read and do some things. I don't go to conferences, integrative, holistic conferences, near like I used to.
Yeah.
I do sleep.
You hear that, folks? Okay. What is your favorite meal?
You know, that's a tough one.
You always talk about breakfast. Is breakfast your favorite? Or it's just because you're responsible for breakfast?
No, breakfast has probably always been my favorite.
Okay.
I don't know why, but yeah, I'd say breakfast. And I like a good waffle with some butter, maple syrup, bacon and egg. I mean, I could probably eat that breakfast, lunch, and supper. But I like a good steak. Good steak, baked potatoes, a salad or veggies of some sort. But it's seasonal. I mean, sometimes I like a good burger. Sometimes, you know, you can't beat a good chili relleno, a good Mexican, food. But then I love Thai food. I mean, it really is. I don't know. I just love
this
food.
This is going nowhere.
Don't ask me favorites.
I like food. I like all food. God food.
Yeah, I'm bad at picking favorites. Yeah. So I hope you don't have any more. What's your favorite?
No, we're taking all of them off. That was awesome. All right, back to the questions. You're the doctor, so you might have to decipher this one. I'm just the messenger. This one said liver autoimmune, and then it said high enzymes, and then bilirubin steroids. Maybe decipher that for us and then speak to it.
So probably that's autoimmune hepatitis. Hepato, that means liver. Itis is inflammation. So anytime you hear itis, that's inflammation. Sinusitis, meningitis, arthritis, colitis. Itis is inflammation, that's liver inflammation. And if it's autoimmune, most likely it's autoimmune hepatitis. So you can see just right there, that's a label. Autoimmune, that your own immune system is turning on your own self, your own tissue. That's autoimmune. Hepa, liver, itis, inflammation. So the immune system decided to turn on this person's liver and attack it like it's a foreign or like it's a foreign germ or toxin. And usually autoimmune hepatitis hits in the third decade of life, I believe, but definitely later in life. So you go 30 years of recognizing your liver as you, and then you wake up one day and it says, no, that's a foreign, I'm gonna attack it. So steroids, where that comes in, steroids tells the immune system to quit attacking. It just says, shut down, go back, turn off, go to sleep, go back to the barracks, troops. There's no war to fight here. So, obviously, when you're really inflamed, your liver enzymes, bilirubin, those are real high because of all the inflammation. So the liver cells are dying. They release bilirubin and other proteins, and we measure those in the blood, and they're really high. So steroids will shut down that immune system, so all that inflammation calms down, and your numbers will come down. The problem with that, steroids have a number of side effects long-term that aren't good. And most autoimmune cases, the immune system eventually is going to figure out a way around that drug that's telling it to shut down. It's going to figure out a way around it and still get in there, start attacking again. Because there's a signaling going on to that immune system to go and fight. And it's going to find a way to do it. And I hear it all the time on these autoimmune patients. And even though this is questions about autoimmune liver, this autoimmune across the board. Joints, colon, myelin sheath for MS, all these are autoimmune. Hashimoto's, that's thyroid. So you can kind of apply this across the board. But so these drugs that suppress the immune response to get inflammation and calm down, so symptoms can calm down and blood work can look better, the body finds a way around it. I had an ulcerative colitis patient the other day, was on her 5th drug to suppress her immune system. Wow. And each time she gets on a new one, it'll work for about 6 months, and then the immune system finds a workaround and starts attacking her colon again. So then they switch her to another one. That's why the end of these commercials for psoriatic arthritis, ulcerative colitis, any autoimmune disease, the end of the commercial is all the tell your doctor if you've had TB, fungal infections, any infection, because you're about to suppress your immune system. So if you have TB or fungal or some infection on board, that infection could kill you actually. So you got to be real careful with those. So, but in the short term, understand someone's really inflamed, their liver enzymes through the roof for autoimmune hepatitis, fine, do the steroid, do the whatever. But get to the root of why is the immune system out of balance. And again, that's a whole nother long show. Or just get on our wellness program, go to education course, go to autoimmune, watch that course. And then get with your wellness navigator and start implementing the things that balance out the immune system.
So one thing with those education courses, we got a question on SIBO, which I know you did a course on, so they can become a wellness member as well and go watch that course. But is there anything you want to speak on? The question specifically was, how do you heal SIBO, which you go in super depth about how to heal it, the truth around it, all that stuff. But if you want to speak to that at all, because I know that's an education course that you've also done that's on our website.
Yeah, we did that education course because it's such a common problem. And by some estimates, 80% of IBS, irritable bowel syndrome, which is just a label again, for symptoms of the gut, which tend to be pain, bloating, constipation, or diarrhea, or back and forth. But that's IBS. Well, 80% of IBS really is SIBO. And SIBO is S-I-B-O. It's an acronym for small intestine bacterial overgrowth. So all the good bacteria in our gut need to be way down low in the colon, in the large intestine. And these guys start to move. They migrate north. And they get way, 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 way up here in the very top of your small intestine where they shouldn't be. And then they overgrow. And then the food dumping out of the stomach right into the small intestine, these bacteria get to have first dibs, and they start processing that food, eating that food, fermenting that food. And the byproducts of that bacterial fermentation, part of it's gas, and that's the bloating and the pain. But it just disrupts the normal digestive process, the normal motility gets disrupted. And the byproducts, the waste products, all this combined create pain, discomfort, slow gastric motility, so bloating, constipation, and all that. But so the treatment for that, you can knock those use antibiotics to knock those bacteria down to try to kill them. And those antibiotics are super expensive. And they typically will work temporarily. It will kill them. But those bacteria down in the colon, they just start migrating again, right back up. So then you got to come at them again and again and again. So it's just management. You're not curing it. You can also do that with herbs. There's different herbs, and we talk about it in the class. Oregano oil, neem, garlic, different ones. They'll knock that down too. But again, they just come back. So in my experience, you cannot overcome SIBO completely with just killing these bugs. Also, you get on a diet and you only eat foods that those bacteria really don't like. So you kind of starve them, and then they don't make as much gas and you don't have as much symptoms. So that's called low FODMAP diet or specific carbohydrate diet, SCD diet. So starve them, kill them. But ultimately, the biggest issue and the reason it came to begin with was stress. The vagus nerve runs the GI tract that keeps the motility flowing, keeps the stomach acid really good, because that good stomach acid and good motility and the gastric emptying, the stomach valves opening and closing appropriately, all of that, normal digestion, all of that's controlled by the vagus nerve. And when all that's flowing good stomach acid, good valves opening and closing, good motility, all those bugs stay down below where they're supposed to be.
Yeah.
So the very root of that, in my opinion, is you've got to get the vagus nerve back in order. And sometimes that's a physical thing from trauma, head trauma, concussions, a car wreck, something got in the neck is off, gets the vagus nerve a little irritated. But in my experience, the psychological trauma, the stress, the stress component's huge.
Interesting. Well, that's exactly what I was going to say. So good job.
Oh yeah, good. Good to have confirmation there.
You answered that very well.
A second opinion. We should do a show called Second Opinion with Blake.
I have all kinds of ideas for our new shows. So another one, I feel like we get a lot of just stomach issues, whether it's IBS, SIBO. One was pretty generic, but maybe you can just speak to, obviously, just Americans in general dealing with stomach issues. So one was their daughter is complaining of stomach issues. What helps? So I know that's very generic, but I feel like a lot of people, it could be as drastic as SIBO, IBS, but even just like my stomach just hurts, I'm just dealing with it, but we're not meant to live that way. So what helps that?
Yeah, that is pretty broad, just stomach problems. That could be a lot of different things.
Yeah.
But in my experience, in general, almost all stomach problems, a component at least, if not the root cause, is not enough gastric acid. A gastric pH that's too high, because pH 0 to 14, 7's neutral. We need to definitely be below 7, but we need to be so below 7, we're all the way to the bottom. We need to be a pH of 1, which is battery acid level. And that is so important because that acid starts to chop up all the food, break down the protein bonds. These amino acids are stacked together to make a protein. And so you chop all that up. And a lot of people are reacting to these food proteins, whether that be dairy or some people react to different plant molecules. Gluten's probably the most famous one. But all that gluten and everything else, it should be all chopped up. Stomach acid does that. Chops up the proteins so you don't react to them. And then that pH of 1 triggers a gallbladder to squirt bile, and that bile chops up the fats. I had a patient yesterday, her stool floats and she just doesn't digest her fat good. Well, she doesn't have enough bile. But probably because she doesn't have enough stomach acid. It's the stomach acid pH of 1 that triggers the gallbladder to squirt bile to break up the fat. And then the pancreas squirts enzymes to break up carbs. But that pancreatic function, again, influenced by stomach acid levels. So almost always, and in like little kids, a lot of times it's an immature, not fully developed proton pump. Proton pumps are what pump the acid into the stomach. So babies that incubated in a mama's womb, and that mama's womb wasn't fully nourished all the way, then those proton pumps aren't all the way matured and they don't make enough acid. That actually leads to reflux because the valve between the esophagus and the stomach will clamp tight, keeping everything down in the stomach where it's supposed to be when the pH is 1. When it's not, when it's a 3 or 4, this valve opens, you can get reflux.
Wow.
The gallbladder, pancreas don't function. So if you have undigested food moving down and not fully digested, because lack of stomach acid, lack of bile, lack of pancreatic enzyme, then that is a problem. That can cause all kinds of cramps and pain and constipation and issues just because you're not digesting your food good. So as far as what to do, number one, real food, real food, real food. A narrow eating window, meaning really go with the sun. Try to eat sun up to sundown. In that window, you need time for the body to process and cleanse and detox and all that. So we don't need to be eating late in the dark hours. Fermented food, those are foods that naturally have bacteria in them. Those are real good for the gut. Somebody will use probiotics instead. That's fine. If your kid doesn't want to eat fermented food, get some probiotic supplements going. Those are good starting places. But
did your kids eat fermented food?
Yeah, they do.
Really?
Especially the sauerkraut Nicole makes, that recipe she has. I mean, they'll go through a whole jar of that in a day.
That's crazy.
But they love kombuchas, kefir, sauerkraut, of course, sourdough bread.
Yeah, that's awesome.
Yeah, and there's ways to sneak it in. You can get a tablespoon or teaspoon of sauerkraut juice, throw it in a bowl of soup. They don't even know it's there. Or mix it in the eggs or something like that. But there's a way to get it in there.
Parents are good at that.
Yeah, parents are sneaky, deceptive. Bubby's is a great brand for their pickles. My kids love Bubby's really pickles. Yep. So and just get outside, get in nature. Don't be too sterile. You know, don't be using hand sanitizer all the time. And I mean, get in the dirt, get in nature, get in the barnyard, scoop some poop in the stalls, stuff like that. Go out to your local horse barn, ask them if your kids can shovel their horse poop, and
they'll love you for it.
It's good. Tell them doctor recommended. We need good bugs. We need the bugs. The bugs are not our enemy. They're our friend. We need a good blend of microbes in the gut, and then a lot of these gut problems go away. But when you're drinking chlorinated water, kills your flora. You're eating processed food, that's preservatives. Preservatives kill the flora. Roundup, which is on all the non-organic food, kills your flora. All the artificial flavors and colors, red dye, yellow dye, all the stuff, kills your flora. 80% of the antibiotics in America are put into our food, kills your flora. We're constantly killing our good bugs, and it's the good bugs that we need to break down this food and to give us some vitamins and other things.
So this kind of goes in line with what you're talking about. Parents, kids, this one specifically is about pregnancy. You can speak to it probably as a doctor. Maybe Jamie would be a better person since she's done this 6 times. But it was tips for optimal pregnancy, and then maybe specifically postpartum recovery, how to replenish your body, those kind of things.
Okay. Yeah, definitely. Probably getting a midwife in here to interview is going to be better. Or Ellie Jean, my daughter's in midwifery school.
She delivered our baby.
That's right. Yeah. Beautiful baby too. And maybe we should ask Vicky because she's recovered and Dax is a pretty stout kid.
He's a stout kid.
It is the basics though, ancestral. And that's what Weston Price found, the dentists in the 1920s, 1930s that traveled the world, is these were super healthy kids. And Native American tribes confirm this. Super healthy kids that never die, never have disease, no SIDS, none of that in the ancestral tribes. And the biggest thing he noted, wrote it in his book, is a lot of these tribes would take the organ meats when they made a kill on an animal. They'd preserve the heart and the kidney and the liver and all the organ meats and save them for the mamas of childbearing age. So there you go. Go eat a bunch of liver, you mamas.
Just a bunch of barbarians out there.
The nutrient density of that organ meat's the point. There's so much nutrition. I mean, that's like a multivitamin, those organ meats, minerals, vitamins, all the B vitamins, so many other cofactors that we probably don't even know about. So that's the main point, get the nutrient dense. Don't just eat the muscle meat, get some organ meat. So if you can get a primal blend, like on your ground beef, or if you get some organ meat and cook it and eat it, or desiccated, that's just basically freeze-dried and powdered into a capsule. That's a good way to go about it. Staying active. There's some specific, physical therapy and other therapists that teach pregnant women how to keep their hips and all those ligaments and tendons and keep them, active and stretched and pliable. And then you're going to bounce back and recover better too. But it's the same things. There's no special, I don't think, really for pregnant versus other folks. You need the sunshine.
Yeah.
You need, I know it's tough later in pregnancy, but sleep. We got to have our sleep. We got to have sunshine. We got to have nutrient-dense food. I don't know that there's any. I mean, for sure, the minerals go. You got to remineralize. That baby's going to be. Your body's going to send the nutrients to grow that baby, and suck it from your tissue if you're not eating enough. So you've got to do the nutrient-dense. I would do the 5 superfood categories for sure, even if it's just a bite or a little bit of each one. But be real cognizant about the 5 superfoods. Again, those are fermented food, homemade bone broth, organ meats, fresh milled grain, and raw dairy if you can get that. I know some places it's hard to get the raw dairy. But just focus on nutrient density and moving around, and sea salt in the water, trace mineral drops in the water, Epsom salt baths, stuff like that.
Great. Then we'll end on this very important question. This is our second episode together. So I've just been kind of exploring a podcast called You're the Cure. Maybe we should update that. So I'm just going to shoot you some podcast name ideas now that we're kind of this dynamic duo. So we can start out with Ben and Blake. Adventures with Ben and Blake. B&B podcast. West Texas duo. Duff and Doc.
Hey. You know,
Should we
Blake,
just stick
I'm kind of old school. That's a little too hip and trendy.
Am I forcing it?
I like You're the Cure.
Okay.
Duff and Doc, you know, that maybe we could, that's a sub, You're the Cure with Duff and Doc.
Duff and Doc.
Yeah, there we go.
Get your questions answered.
I like it.
This was awesome. We won't use any of those probably. We'll stick to You're the Cure. It makes more sense. But thanks for coming on the show today.
Oh, thanks for having me.
It was a pleasure.
Yeah, great idea.
For those of you watching, you stuck with us. We'll continue to do these. Don't know how often, but please follow us on Instagram, Dr. Ben Edwards. Message us your questions, reply to stories, however you want to do it. And we'll take notes of these questions and record another episode to get your questions answered. Dr. Ben may come on, do a live Instagram, answer your questions on there, so be sure to go follow us to get some more information. You want to send us off?
Thank you again for great Q&A time. I like to answer questions, so appreciate it. Next time we'll reverse this. Let you answer the question.
So many unanswered questions by the end of the episode.
Well, I was just talking to a med student the other day, and she said that the dean of her medical school even told their incoming class, hey, 50% of what we teach is going to be wrong. You know, the dean of Harvard Medical School, I quote that from 1940, said that, and it's clear the medical research shows that most of what we learn, it's not even right. So, I mean, it might be that we need to do the switcheroo.
Fair enough.
We've lost common sense. So,
I can handle it.
You know, if you got some common sense in you,
yeah,
probably
none of it will be medical advice, but
true.
I can just.
Only doctors are allowed to prescribe and treat. That's the practice of medicine. But we're trying to get people to not need that practice of medicine in their life. So we'll keep going on this deal.
Yeah.
Thanks for having me on my show.
All right. See y'all next time.